What up, everybody? Dr. Markel here. Happy Friday. So, the past couple weeks, we have had a few cases of tongue and lip tie, or concerns of tongue and lip cases. And so, I wanted to pop on here, talk a little bit about what tongue and lip ties are, why they're becoming more common, what the traditional approach is, and why chiropractic should also be considered a worthy, I don't want to say adversary to the tethered oral tissues, but a good option. So, tongue and lip ties, like I said, have become more common. And what tongue and lip ties are is, if we're talking about a tongue tie, the frenulum that connects the tongue to the bottom of the mouth, what it does is that tissue is either too short, too tight, planted where it shouldn't be, and so it can cause difficulty with movements of the tongue. Lip tie is going to be the opposite. It's going to be where the little string of tissue that connects the lip to the gums, I guess, is either going to be planted down too far, or in some cases it can even be between the teeth or even on the inside of the gums. And so the problem with this that we see obviously in kiddos is going to be breastfeeding. Huge issue. Some things that mom can notice is if breastfeeding is crazy painful. If the kiddo's got a painful latch, or if her nipples bleed, or if kiddo is not gaining weight, if kiddo has acid reflux, if kiddo doesn't like tummy time, those are all really good indicators that we should be assessing for a tongue and lip tie. All right. And so obviously we see the problem with breastfeeding. What we're actually seeing further down the line is going to be problems with speech, problems with posture, problems with motor, social, academic development. All right. And so you might be wondering, why the heck has this become an issue all of a sudden? And Dr. T and I have actually been going through some training, and one of the theories out there that's gotten a lot of backing and is really taking a stronghold. So back in the 90s, when everything was to prevent neural tube defects, and so they started fortifying everything with folic acid to try and prevent the neural tube defects. Around that same time, since then, I should say, we have noticed a decrease in neural tube defects, but what we've noticed is now we are seeing a mutation in a gene. It's called the mother-father gene. And what this gene does is it's very important for a process called methylation. Methylation is really just a fancy word that means it keeps our DNA healthy, helps to maintain our overall health. So we start fortifying our Cheerios and our bread flours and our cornmeal and our pasta and our rice and all that stuff with this folic acid to try and get rid of neural tube defects. Neural tube defects go away, but now we're seeing a defect in these genes, and that defect in the genes is often associated with tongue and lip ties. Okay, so I told you some different things we might see as far as breastfeeding issues, speech issues, acid reflux, immune, stuff like that, but what is the big issue here? So, tethered oral tissues, this is the all-encompassing word for tongue and lip ties. What it means is it's a midline defect. That means it affects the center of our body. The tongue is anatomically attached to the bone and the facial structures of the head and the torso, okay? So if those tissues are tight, that's a good indicator that the muscles in the throat, in the mouth, are going to be tight as well. So we're going to be seeing posture issues, all right? In a kiddo, it might not seem like that's a big deal because they're balls of goo, obviously. The problem is that it isn't a huge issue as the kiddo goes on to grow and develop. That tension in the muscles of the mouth, muscles of the neck, muscles of the head, it can actually create long-standing structural changes, all right? So commonly what they do, there's two different revisions. Now they can actually use a laser to clip the tie, or they'll actually go in with a scissors. Or a scalpel or a cutting instrument of sorts to release it so we can get more movement of the tongue, more movement of the lips, which is going to equate to not just better breastfeeding, it's going to equate to healthy development of that sensory motor system, okay? So obviously, an intervention is an early assessment, early intervention is needed, but how does chiropractic tie into that? Well, in addition to the structural stuff that we talked about, the postural changes, the tight muscles, everything associated in the head and neck, most of the sensory input in our body, the information about where our body is in space, what processes it's doing, how it's going, most of that information comes from the cervical spine, aka the neck. And so if we do have those restrictions, if the information and feedback is not able to get back to the brain, how can we develop? How can we grow? How can we develop adequate social, academic, motor, athletic? Any of those skills are not going to be there, all right? So, first and foremost, I probably should stress that we are not able as chiropractors to diagnose a tongue and lip tie, all right? However, we do know what to look for and could could point you in the direction of someone who could help. So if your little one hates tummy time, has problems breastfeeding or latching, if they have tummy issues, acid reflux, if their head is flexed down like this, or if you have even an older child who is having difficulty learning speech and you feel like they're not developing as quickly, chiropractic is a great first place to start. So please share this if you feel, or if you know someone with little ones who you think might be dealing with this, or go ahead and give us a call, 701-893-3150, and we can hook you up. Thanks, guys.